Good afternoon, everyone, and you are very welcome to this episode of QPS TalkTime. It's a very special episode today because we are introducing and launching the National QPS Competency Navigator, and you're going to hear lots about that. We encourage you to follow us on social media. We are available now on YouTube at National QPS and on LinkedIn at HSE National QPS, and you can find previous episodes of this webinar that have been recorded on the YouTube channel. So today's session is about, it's really the launch of our new Quality and Patient Safety Competency Navigator, which will help you to identify your personal development needs and that of your service. Find out how the Navigator was developed, and I think we'll hear from people who are involved in that today, and I must say it was a great example of co-production. And where you can find out about it and how you can use it. You're going to hear about learning opportunities, programs and resources, and new additions to the 2025 QPS prospectus, which is about to be launched. And we encourage you to engage with the panel, to ask questions and share your views on competency development in quality and patient safety. So today's speakers, we have several speakers here, and again, this was a big project and really sought to be a big project and engage as many people as possible. So I'm hoping we'll have Orla Healy with us, who's the National Clinical Lead for Quality and Patient Safety in NQPS. We certainly have, I can see her there, Dr. Louise Hendrick, who is the project lead for the program. Tibbs Pereira has joined us as well, who is a member of Patients for Patient Safety Ireland, and Tibbs also was a contributor to the QPS Navigator. Dr. Aoife de Bruin from UCD, who was the major academic partner here in the development of the Competency Navigator. Veronica Hanlon, who is an educationalist with the NQPS team, and really, I think, brought the QPS Navigator through all the humps and bumps and ups and downs that it had to go through, and so I think this is a proud day for Veronica, and to welcome Una Healy as well, QPS manager from St. James's. So we're going to hear from our speakers, and they're going to, I think, tell you maybe a little bit about the story of how the Navigator was developed, and tell you a little bit more about it, where to find it, how to use it. Is Orla with us?
I'm going to introduce John on Orla's behalf.
So okay. We'll go on to the next slide there, Louise, and if you wouldn't mind, obviously I want to thank Orla here, I think, again, for her sponsorship, and I think the leadership she's shown in bringing this to conclusion today. And Louise, you might just do that introduction for us, please.
Absolutely. Thanks, John, and lovely to be with you this afternoon. So on behalf of Orla, who unfortunately couldn't be here, you'll know she's the National Clinical Lead for Quality and Patient Safety, and she wanted to welcome you all to the launch of this important Quality and Patient Safety Competency Navigator, which is the first of its kind in Ireland. Developing quality and patient safety competencies is obviously a key priority for us, and this resource, we hope, will support students, staff and patients to develop their quality and patient safety knowledge and skills. This project has been, as you mentioned, a 2-year collaboration by the Quality and Patient Safety Education team with colleagues from the UCD Iris Centre, staff, patients, academic partners, and it has been an absolutely excellent demonstration of co-design in practice. So Orla asked me firstly just to extend her thanks and her congratulations to all those involved. And then I suppose just myself as a project co-lead. So as you mentioned, I'm Louise, and I'm the Clinical Lead for Quality, Patient Safety, Intelligence and Education in National Quality and Patient Safety, and I'm really delighted to be here today. It's been a real pleasure to be involved in this project, and I'm delighted to introduce you to, and I suppose to take this opportunity to extend my sincere thanks to the fantastic project team, who you've kind of introduced, John, but I'll just go through it again. So we have Dr. Aoife de Bruin, who's with the UCD Iris Centre School of Nursing, Midwifery and Health Systems in UCD, Veronica Hanlon, Stephanie Horan and Dr. Gemma Moore, who are from Quality, Patient Safety, Intelligence, Education, National Quality and Patient Safety. Dr. John Fitzsimons, yourself, who we were very lucky to have involved in this from Children's Health Ireland and National Quality and Patient Safety, and Dr. Dimuthu Ratnake from the School of Public Health, Physiotherapy and Sports Science in UCD. And I suppose I'd like to take this opportunity to extend my thanks to my predecessor, Dr. Mary Brown, who's the former Quality and Patient Safety Education lead, who really started this journey and got the ball rolling. So just moving on from all the thanks for the project team, I suppose I'd also like to acknowledge the work and the effort and the expertise of the advisory group, the more than 70 members of our co-design panel who really gave so generously of their time and their expertise and guidance, and to all of those who also gave their time to test the navigator for us at various stages of the project. The need to develop quality and patient safety competencies is underpinned by these documents. So you know the patient safety strategy, which really guides us in what we do in quality and patient safety, and is committed to empowering and engaging staff and patients to improve patient safety. And also then Sláinte Care, obviously a cornerstone of health system reform, which guides overall improvement of our health service and competency and capacity development. But in addition to these guiding documents, in 2022, the Quality and Patient Safety Education team engaged with quality and patient safety leaders and staff from across the system to see how best we could support them. And during that consultation process, the need to support and around the identification, standardization and development of key quality and patient safety competencies emerged. So it was felt that a resource that supported staff, students, patients and service users to identify what they needed to know in relation to quality and patient safety would really help with their professional development, engagement with the system, and also informing education and training programs for all. So on foot of that, we commissioned our colleagues in UCD to help us develop quality and patient safety competency framework. And we began what has been a 2-year journey. And I'm now going to hand back to you, John, so that we can hear a little bit more about that journey, and in particular, I suppose, around the co-design process. Thank you.
Thanks, Louise. I think as I'm going to hand on now to Dr. Aoife de Bruin, who is from the UCD School of Nursing, Midwifery and Health Systems. And Aoife and her colleagues were our major academic partners in this work. And I think it's fair to say we could not have done it without them. And again, I want to thank Aoife for all her hard work. And Aoife, you might just bring us through how this came to be and how it was developed.
Great, thank you very much, John. Like Louise, I've been delighted to co-lead this project with the HSE team over the past 2 years. As Louise mentioned, we have led on the kind of research-informed aspects of this work, including gathering the evidence and planning and designing the co-design workshops along the way as well. So today I'm going to spend a couple of minutes telling you a little bit about the work undertaken to get to this point in producing the QPS Competency Navigator. So this slide will give you a sense of what we did during that 2-year period and some of the key milestones along the way. So as you can see, we began with a scoping review of the literature in January 2023, where we looked at other competency frameworks, both nationally and internationally. So we conducted a large scoping review, which led to the identification of over 100 academic papers, which really helped to inform the planning of subsequent phases of this work. So what we did is we identified competency statements and quality and patient safety topics used elsewhere, and these really fed in to inform our work during the co-design workshops. During March and April, then we conducted a number of outreach sessions. Over 100 people attended these 3 online sessions, which really emphasised to us, I suppose, the enthusiasm for this project and the perceived need for it as well. From that, we were gratified to have over 70 people who volunteered to work with us as members of the co-design team. During that time, we also established an advisory group, which consisted of experts in quality and patient safety, healthcare staff and managers, patients and patient partners, academics, amongst other experts as well. So in December 2023, we presented a first initial draft outline of what the framework might look like based on our initial co-design work. And really during 2024, the lion's share of the co-design work was done. So our work was kind of developed, refined and tested by the project team in collaboration with our co-design panel. So during this testing, we engaged with really the intended end users for the Competency Navigator. So people from different backgrounds and levels of training in healthcare, as well as patients and patient partners, to really ask them to use the Competency Navigator that we put together and to get their feedback on how it was to use. So in total, 31 people who hadn't been involved in the process to date took part and gave us really useful feedback to help them make the document more accessible, more user-friendly, and importantly, more relevant to them in their role. So for the last few months, we've been testing and refining and I suppose sending the document off for graphic design to get to today, really. So I just wanted to, I suppose, elaborate a bit on the co-design aspect of this work, which was really central to the success of this project. And we were privileged to work with a group of enthusiastic and expert collaborators, including members of the public, patient partners, healthcare staff, managers, representatives from professional bodies, academics, and educators. So this project, through the co-design approach, really leveraged their collective expertise, their experience, their knowledge, as well as their views about what people need to know and need to be able to do to support quality and patient safety at various levels in our healthcare system. So as part of the co-design process, we established different subgroups where people could kind of select to work on the topic that they're most interested or most expert in. We also held 4 in-person workshops, and some of the photos you'll see on the slide there are taken at these workshops. And each of the 5 subgroups held between 2 and 5 online workshops via Zoom as well. So I think you'll agree this engagement represented a huge commitment from those involved, and it was really their input that made it what it is. Everyone that took part is acknowledged in the document for their input, and I know many of you are here today, so thank you all for your engagement over the last 2 years. The process was challenging at times, certainly, but always beneficial. Sometimes feedback forces us to go back to the drawing board a little bit, or to revise things, or often to simplify things a bit further, but it was always useful feedback and always something that we needed to hear. So a massive thank you again to everyone who joined a co-design workshop at any phase during the project or provided feedback to us at any stage. So following many different versions, we ultimately decided as a group to have 6 topic areas in the Navigator representing core aspects of quality and patient safety. So this slide provides an overview of these topic areas. They include quality and patient safety culture, communication, teaming and systems, which also speaks to human factors, quality improvement and clinical audit, safety, risk and incident management, sustainability, and partnering with people. So we really wanted this Navigator to be clear, easy to navigate, something people can zoom in and out of as needed. So almost something that people can use as a signposting document to enhance their skills and knowledge of various aspects of quality and patient safety as needed or as required. So I'm going to pass back to John now before we give you a demonstration of how to use the Navigator. Thank you.
Thanks, Aoife, and yeah, thanks again. Fantastic work, and I think it all looks so simple today. When it's all come together, but it did take it a long while, didn't it, to get it into this shape and to get it looking so nice and neat.
Lots of back and forth, yeah.
And that is, I suppose, that's what we all learned about co-design, isn't it? That's what's needed. That is the nature of co-design, is that it's messy and I think we might just let Veronica show us the document now. And Veronica, you're going to try and link us to a version of the document, hopefully, and walk us through how it should be used.
Where I'm going to start by just showing you where you can access the document. So as Aoife alluded to, this is probably version number 600 at this stage. So we've gone through quite a bit of changes, but the document now sits and will be hosted on the National Quality and Patient Safety website. So if you go onto the website and just scroll down, you're going to see under the featured news, we have the little link to the landing page for the Competency Navigator. Now, there's lots of information there on the page, but to access the resource itself, here you can click on this link, and this will bring you directly to the Navigator as it looks today. So it is a PDF document, but we wanted to, as much as we possibly could, make it look and feel like an e-learning document that would be easy to navigate. So you'll see as you go through the document that we have got a number of navigation buttons, so you can either page down or page back or use the navigation buttons to take you through the document. So the first couple of pages, you'll have your table of contents. We also have a foreword and a message from Dr. Orla Healy and Dr. Colm Henry. And during our co-design process, we were given a lot of feedback about making this document as accessible as possible and as easy to read and understand. So wherever there are large pieces of text, you'll also have an opportunity maybe to watch a video instead. So here, for example, you can click on play video and you'll hear Dr. Colm Henry talking about the Competency Navigator. So if we navigate through the document, I'm just clicking on next here and it brings me to the next page. And I just wanted to draw your attention here to the number of professional bodies and offices that supported us over the 2 years. And again, we'd really like to thank them for their support. So moving to the next page, we have an introduction. Just tells us what the Competency Navigator is, how you can use it. And one of the things we found throughout the process was that there are a lot of terms and acronyms associated with quality and patient safety. So we gathered together a glossary of terms. So by clicking on this button, it'll bring you directly to a number of terms and it'll give you a definition of those. And to get back to where you were, you've got a little button here on the top right-hand corner, which will take you back to the introduction page. One of the documents that pretty much goes hand in hand with the Competency Navigator is our Prospectus of Education and Learning Programs. And we'll be talking about that more towards the end of the webinar. But we've given a direct hyperlink to that document here, and that'll give you ease of access as you're working through the Navigator. As Aoife said, we wanted to make the Navigator as easy to use as possible, so we've broken it down into 4 steps. So the first thing you will do is select the job category or the role category that best describes you. Then you can select the topic that you'd like to explore. So we're very conscious that people might only be interested maybe in quality improvement and might want to navigate through the various sections in relation to that topic. So you can do that and you can dip in and out of it. Step 3 is where you'll have an opportunity to read the competencies that are associated with that topic, and you can identify areas for development, and I'm going to show you how to do that. And then step 4 is where you can review the suggested resources available for that topic, and you can decide which ones you'd like to include in your development plan. So I know some of you, because of your professional registration, you might have your own development plan template that you need to use. But if you don't, there is a development plan template that you can click on this little button here, and it'll bring you to an MS Word version that you can populate. Moving on to step 1. So the role category here is, we've broken them up into 6 role categories. The first one, everyone working in healthcare, applies to everybody, whether you're a frontline care worker or whether you're working in a support role. And this category would also apply to students. So we'd suggest that this is probably a good place to start for everyone. But you might also be a team leader and you might want to have a look at that category. Or maybe you're a quality and patient safety manager or a lead. Or just somebody who maybe you're a clinical person, but you've got a real interest in quality and patient safety, and maybe you take on a champion role in your area. So that third role category might be relevant for you. We also have a category for senior leaders and board members, for patient and patient partners. And you'll note in the document, we use the term patient, but this does apply to patients and service users throughout. And then we have a final category, which we're calling On the Path to Mastery in Quality and Patient Safety. So this is for people who are maybe very experienced or passionate about deepening their understanding of quality and patient safety. And typically they might be people who influence, coach or educate around quality and patient safety in their area. So you can decide which category you want to dip in and out of. For the purpose of this demonstration, we're going to start on the everyone working in healthcare category. And I'm just going to click on it and it will bring me directly to that category. Once you're in the category that you want to explore, the next thing the navigator will ask you will be to select the topic you'd like to explore. So as Aoife mentioned, we've got 6 topics. And again, just for demonstration purposes, we're going to select safety, risk and incident management. And you can do that by just clicking on the segment of the competency wheel here. So this will bring you to a page that will explain what we mean by safety, risk and incident management. And again, in an effort to try and make it as user-friendly and as accessible as possible, you can click on this play video, and here you'll be brought to a video, and in this case we've got Una, who you're going to meet later on, and Una will explain what is meant by safety, risk and incident management. Now, if you prefer not watch the video and read the transcript, you can click on this little icon here and that will bring you to the transcript directly. At any point, if you want to go back to the competency wheel and maybe you want to look at quality improvement at this point, this little button up here in the top right-hand corner will bring you back. But once you've got an understanding of what's meant by safety, risk and incident management, you might then want to move on to looking at, well, what competencies do I need to develop in this area? So here we've got a list of competency statements. And for example, if you read competency number 2, I understand the importance of managing safety by reporting and monitoring risks. And you thought, well, I don't really know how to report. You can select that statement. And likewise, you can, read all of the others. Maybe we'll take the last one there, which relates to safeguarding, and we're going to select that one. And these are 2 areas now that you've identified you need to develop in. So the next step in the process would be, well, how do I develop those competencies? What knowledge and skills do I need to develop, and how can I do that? If we click the next button, here it'll bring you to a series of suggested learning resources. So we've broken this page into 4 segments. On the top right-hand corner here, you've got a number of learning programs that are available. Now, many of them here you'll see are hosted on HSC Land, or they might be hosted on a website. And where we could, we've provided you with the hyperlink that will bring you directly to that hosting site. So there are a number of learning programs. If you wanted to do a little bit of further learning around a topic, we've given you some suggested further learning opportunities there. And to the bottom left, there might be a number of policies, procedures, or guidelines that it would be important that you're aware of, and they're listed in the bottom table there with hyperlinks. Now, during our co-design process, we got a lot of feedback from staff in particular, who said that they were finding it difficult to do even the mandatory training. So we came up with a number of suggestions whereby you can learn while you work. So these are in-practice development opportunities for you to consider. So for example, for this topic, it could be getting involved in a risk assessment for your area, or, taking part in a safety huddle or a safety pause. So that's something that has been very welcomed, I think, by a lot of the people who worked with us on the co-design team. So hopefully what I've shown you there is, first of all, where to find the navigator, how to use it by going through the different steps. And at any point, if you look to the bottom right-hand corner here, you'll be able to return to the competency wheel and pick maybe clinical audit and quality improvement, and that'll bring you to the same set of pages associated with that topic. So just one more thing I wanted to draw your attention to before we leave. If you go to the very bottom of the document, we've got a list of people who were involved in our co-design, and again, we'd really like to thank them for their support. It was absolutely invaluable over the 2 years. And while there were times when we did have to go back to the start, I think it was well worth it, and it was worth going back to go forward. But one of the things we would like to do is make sure that the navigator is a dynamic document, that it's kept, very much current and up to date as much as possible. So on the very last page, we've got a link here. So we would encourage you, if you're using the navigator and you spot something that needs changing or needs updating, or if you've come across a resource that we haven't listed and would like to suggest it for the next revision, please click on this link, pop the information in there with your details, and we will certainly include it in the next revision of the document. We'll be reviewing the navigator each year as part of our normal evaluation and review of a lot of our learning resources, and we will certainly try and incorporate as much suggestions as you make in that review. So that's it, John. Back over to you. Thank you.
Thanks, Veronica. That's really brilliant. And again, you make it all look so easy and simple. And I think, again, that's down to, I think, all the hard work that's gone into this. And good design always, I think, has a lot of hard work behind it. And I think it's wonderful to see it. I think it's safe to encourage people really just to explore it as well, isn't it? I mean, I think that the best way to familiarize yourself with this is just to start wandering around it and finding, you know, where it takes you to. Would that be fair to say?
Absolutely, and I think that's the beauty of it, John. You can dip in and out of it. You know, you can actually download it onto your desktop if you want to, and work on it and
Yeah.
save, you know, the selections you make. But absolutely, yeah, play around with it.
Yeah, well done. And I know, again, you put your heart and soul into getting it to this point, so it's fantastic to see it. Well done.
Thank you.
I'm going to welcome now Una Healy and Tibbs Pereira, and Una and Tibbs, you're both very welcome to QPS Talk Time, and you are both involved in this, and Una, you know, you were involved because of your role in quality and patient safety and risk management at St. James's. Can you tell us a little bit about your experience of being involved in the project, please, and you know, what you take from it, and the experience of this co-design process?
Hi, yes, lovely, John. Thanks. And I suppose really it's a great day to see it live on the screen, and I'm itching to get at it. The experience, I suppose I was quite naive. I came to it thinking, we'll have this nailed within 12 months. Because again, I was only thinking of it from my own little universe, looking at it from unilaterally how we could just develop a navigator, which was so sorely needed. But the whole co-design process was wonderful because it made you stop, think of it from other people's perspectives. And that's where it led to a much richer document. And I think that is why it took 2 years. We've evolved with something that has been inclusive, really broad, and it's that whole interactive piece where you can tip in and out. And that's what's crucial to make it a success.
Fantastic. And how would you see your colleagues and staff members at St. James's using this?
Um, there's no doubt I can see it happening. And St. James's is acute, very large, very dynamic. But how I see this across the whole health sector is I think healthcare is in a bit of transition at the minute. And I think when I started developing my skills many years ago, I was really fortunate. I was immersed with very skilled staff, leaders who worked at the bedside. So I had lots of role models. But healthcare is transitioning at the moment. So there's no better time to have something for all staff. Because for me, safety is everybody's responsibility. So from the moment a patient interacts with any health service, people need to be on their toes. They need to be very safety conscious. And I think that's the beauty of this document. It's not directed at healthcare staff who are clinical, it is for everybody. And that's what the magic of it is. So I can see that I'll be seeking champions throughout the organization because that's how you immerse something new. You get your champions and you bring them on the journey with you.
Yeah, great. And I think that strikes me as well, is it's the interdisciplinary nature of it, that there's a language in here that I think no matter what your clinical role is, you can find yourself in there. And I think, you know, and it's not just about staff either. It's also it's about patients. And Tibbs, you were involved, and you're very welcome. It's good to see you here again. But you know, you and your colleagues have been involved in this as well. And what's your experience been?
Oh, yeah, I'd echo a lot of what Una has just said from you know, from a patient's perspective. You know, I'd like to thank Louise and the HSE team for being, you know, genuinely very inclusive and including us from a very early stage, and really being patient and listening to our input, and you know, our own lived experience as well as Aoife and the team from UCD for being incredibly patient, because a lot of the time, you know, I'm really conscious some of our input was possibly contradictory and maybe overly demanding, and at times probably unreasonable as well. You know, our focus really, you know, because we work under a World Health Organization program, Patients for Patient Safety, you know, the program, and a lot of it is about engaging patients in their own care. And in order to do that, you know, there's a lot in the partnering with people topic area. that's about how people can be empowered in order to be effective partners in their own care. So, it was really useful being able to provide that input, from our own kind of experience, but also our own objectives as Patients for Patient Safety Ireland, and actually have a real impact on the Competency Navigator.
And Tibbs, why do you think it's important that patient partners are familiar with this, with the language of safety and quality and the competencies that underpin it?
Well, I mean, there are two categories of patient partner. There are people like us, members of Patients for Patient Safety Ireland, members of the Patient and Service User Forum, and so on, who work as volunteers, and provide our input. And for us, there is, we try and inform ourselves as much as possible. But the reality is that every patient and every service user needs to be regarded as a patient, as a partner, and be empowered to act as partners. And there's a lot there in the partnering with people that actually suits both categories, because for members of our group, as an example, we can't pretend to represent all patients. There are not large numbers of communities, maybe more marginalized communities, who are just not able to engage in the same way that we do. They may not have, the knowledge or the skills, or quite often the confidence, or even the time to be able to do this. So, it is really good having something like the Competency Navigator, where it can be used to empower every person out there.
Great. And Una, do you think in St. James's this will be useful for your patient partners there, and how will you promote it to them?
100%, because we can do nothing in isolation. We can only lift the safety by having everybody engaged. So, of course, we have to have our patient partners on our journey with us, because it's not our navigator. It really belongs to patients and their partners.
Great. Well, thank you both. I'm going to invite you to stay with us as we bring back, I think, all our other speakers, and we might get some discussion going with our audience here. And I'd really encourage people to give us any comments or questions they might have in the chat there. I also want to welcome Dr. Orla Healy. Orla is the National Clinical Lead in the NQPS, and Orla, you're very welcome to QPS TalkTime. And we were just saying earlier, it's a great achievement, I think, to see this competency navigator come to be available to everybody now.
Indeed it is, John. It has been a priority for us over the last few years, and it's wonderful to see it come to fruition. And I'm very confident that this resource will support staff, but also students and patients, to develop their knowledge and skills. I would like to take this opportunity, and I know we're going to have some discussion, but I would like to take the opportunity to pay special thanks to all of my colleagues who've collaborated so successfully to deliver the project. It's been 2 years' work for the education team, for Aoife and her colleagues in the RS Centre, and for the staff, patients, and other academic departments. So I think everybody will agree now, and they certainly will agree in the future, that it's an excellent demonstration of co-design in practice. So a hearty congratulations to all of you, and I certainly look forward to the optimal use of this navigator and development to meet our ever developing and ongoing needs. Nothing stands still for too long in this system. Thank you.
Thanks, Orla. And I might put that out there just to the panel, to Louise and Orla and colleagues. How do you see people using it? Who should use it? How should it be promoted? And where are the benefits going to come from? Louise, do you want to maybe make a comment on that first?
Sure, yeah. I mean, we've always intended that everyone would use it, and we've really seen it in its widest form. And as Veronica introduced it, you'll see that we have those categories that really start with everyone. I think it was Una mentioned that we see QPS as everybody's business, and that's really been integral to this process throughout. So no matter whether you're new to the system or you've been in it a while, it's really designed that you can access this and very readily self-assess where you're at and look at the opportunities to move forward. We do go all the way up to the mastery category, so we're really trying to, ensure that it appeals to everybody. And beyond this, I suppose, as Veronica mentioned, it is a dynamic document, and we do see opportunity to further extend into, academia and work with other partners around their use. It's not specific to the HSC, I will just say that as well. So, we'd really support others in using this, adopting this for their needs, because there's a lot in there and it's really a wealth. And, in keeping it as a dynamic document, we hope that it'll stay up to date as we move forward. So everybody is the short and the long, John.
Yes. And I think, we would encourage, I think, people probably to share this internationally as well, because I think it's a great contribution. I was just wondering about the value of the co-design process, why does co-design take time?
Yeah, absolutely. It's definitely an ambitious co-design process, I suppose, that we undertook, especially with the amount of people that were eager to be on our panel. But I suppose where the value is of the co-design process is that it's a shared process. Everyone who is part of the process has a degree of ownership of it. They have a vested interest in making it something that's valuable for them and valuable for people like them. And that was the benefit, I suppose, of including such a range of stakeholders. As Una kind of alluded to, we each represent a kind of a tiny keyhole on the healthcare system. So we needed lots of different perspectives to make sure that we're producing a document that really meets the needs of people in various roles and various places and positions in the health system as well. So that took a long time. That took a lot of learning for each of us, I think, in terms of learning from other people's roles and perspective. It required that going back to the drawing board when, we were told, no, this doesn't meet our needs. And that's kind of what we needed to hear. If as academics, we went away to design this just based on literature, we would have come away with a very different document that I don't think would have met the needs for people in the health service. So I think that's really the benefit of it.
Yeah. So, I mean, the benefit of this co-design, I think, will be that it belongs to everybody. I mean, it has been really developed by all the people working. And I'm keen, maybe just the value of testing it as well. What did you learn from testing it?
Well, that was a great process because we were kind of deep in the weeds. We didn't have that we needed fresh eyes on it. So going to 31 people from various different backgrounds, people representing various categories in our framework, different levels of healthcare staff, different professional groups, as well as patients and patient partners, they were just able to look at it as something completely new to them. And we were able to understand, was it clear? Was it accessible? Did we explain things well? Were the links and resources valuable? Is there anything we'd missed? So that gave us a degree of confidence that, we were getting there and getting close, and we got really valuable suggestions from that process, particularly around language and accessibility. We spent a lot of time, I suppose, working with colleagues, working with specialized software to make sure that we were writing things in as plain English as we could. I mean, some things are more technical than others, but we wanted, especially the everyone section, to be as accessible as possible, so everyone has the same starting point as well. So we spent a lot of time on that, and that was often the feedback we received from the co-design team as well. Can we reduce? Can we simplify?
Fantastic. And Veronica, maybe with your educational hat on, how is the design going to help educators here? And the fact that it's so much thought went into that.
That's a good point, John. And, while primarily we're saying it's a tool for people to assess themselves individually, I think as an educator, it's an excellent tool to inform your learning outcomes for your programs. So if you're starting to develop or revise a program that's related to quality and patient safety, I'd really encourage you to look at the Navigator, look at the competency statements, and they're easily translatable into learning outcomes. So I think, and one of the things we will be doing is, promoting the Navigator with our colleagues in the HSE and beyond who develop programs, like our colleagues in ONMSD, in NDTP, Health and Social Care Professional Office, and indeed our academic partners as well.
I might just come in there, John, if that's okay.
Yeah,
I think what really will be key here is introducing it early, because if you develop it within a healthcare system like me in St. James's, you want to know that the staff coming in are already familiar with it and have already sort of navigated their way through it, because then you're meeting each other halfway and you just hit the road running on that journey of improvement and quality, so that at all elements of care that every healthcare worker will interact with it. And I think that's where the key role comes in. Share it often and early.
Yeah, fantastic. You know, and I think it has that ability to influence, I think, workers, but also students. They were
Yes.
a group that were kept in consideration throughout the whole process too. And I think it will help with getting some of these competencies into student curricula as well, and undergraduate curricula. Maybe a broad question for everybody in the panel now. Just where would you like to, to see this in a year's time? What would you like people to be saying about the Navigator in a year's time? And Tibbs, what about you? Any ideas how you'd like to see this, turn into reality in the world and influence, practice?
Yeah, well, kind of, if I like selfishly, what we were thinking about from a patient and service user perspective, uh, is that this is used as part of standard approach to patient empowerment and people empowerment, and through health literacy and other means. So this becomes part of almost patient experience that's made available to everybody. And there are a few kind of little barriers. For example, some of the HSE land components. It would be great to make it completely open access. Just remove that one barrier, for example, where people have to create a login to HSE land and so on. So we would like to see as much of this as possible made widely available to every patient and service user in the country.
Great, thanks, Tibbs. Aoife, where would you like to see it in a year? And from a research point of view, what are the important kind of research outcomes here that you'd like to see us look at?
That's an interesting one. I mean, I suppose in a year's time, like Tibbs, I would hope that members of the public would use this document as a way to learn more about how they can get involved in supporting the healthcare service, and kind of an entry point to as where do I start if I want to do more. I think that would be great. It'd be great to see people, using it in their, their own development plans as they plan for maybe promotion to different roles, get an idea of what that looks like for quality and patient safety competencies. But ultimately, I suppose what an indicator for me, and maybe it's a proxy indicator, but an indicator are people like responding to that survey at the end of the document, giving us ideas about what else to include, suggesting other programs, because that's a sign that people are using it and want it to be updated and the highest quality possible. So I think if that's active, that's a sign that people are using it, they see the value of it, and they want to keep using it.
That's fantastic. So, I mean, I suppose this was a community creation from the co-design group and the advisory group, but we can also use the finished document now to create a community that helps to, keep the document alive and developing over time. That's fantastic. Una, what about yourself?
In a year's time, I suppose for me, success with the Navigator will be when a team approach me and say, Una, could you work with us and maybe assess us against the Navigator? Because
Okay.
when you self-assess, you measure yourself at one level, but maybe peer assessment is also really valuable. And that collaborative self-assessment as well as peer assessment, I think, is moving it on to the next level. So and then looking forward to version 2.
Wow.
Mm.
Fantastic. And what strikes me is people are, making comments. It's like a catalyst, that the navigator can help us kind of to move things on and I think it will be an influential document on other things, like you said, like promotions or on educational curricula. Veronica, what about yourself?
Um, I'd love, John, that this time every year, as people are sitting down to either do their performance achievement, discussion meetings, or just planning for the year ahead, that this becomes the go-to document alongside our prospectus. And one of the things, like we launched our first prospectus only, I think it was 3 years ago. And this time every year, we keep getting emails, when is the next edition out? And I'd love if this was the same. And our next edition of the prospectus, actually, it's currently in the final stages of sign off. So we expect to have that on our website in the next couple of days.
Great. Thanks, Veronica. And Louise.
I mean, I'd echo what everybody else has said, but I guess I'd take it even back a step and just hope that everybody finds a use for it and they adapt it to their needs. So I think some people will dip into part of it. They won't use all of it. They may not choose it for their, development, personal development planning. But I think it's more that it's used and it becomes that kind of one-stop shop. And I suppose even, with the regionalization and changes, whether people start to adapt it and add to it locally, and build up and add their local programs of work. And really, I suppose it's kind of a jumping off point. I'd like to see some of the areas, develop further. Sustainability obviously is in its very infancy in terms of QI. So it'd be great to see that. But really, I just hope it's used. And that's, I think the co-design process is the strongest chance it can have really around, making sure that it is used, because it's been designed for the people who will use it. So that's my hope in a year's time.
Great. And I think, that's really important, is the standardization that this brings, and especially as the regions are developing and trying to kind of, I suppose, develop their own approaches to quality and patient safety. Orla, what about your thoughts?
Yeah, when you're the last to comment, you echo what everybody else has said. I would add, obviously, I echo everything that's been said. Having it in common usage with multiple hits is our quantitative assessment, and we clearly want to see that. But I want it embedded in our, Tibbs has commented on the general public, he's commented on academia. I want it embedded as a go-to document in the HSE, HR induction, promotions referenced by Una, embedded in curricula, in undergraduate and postgraduate programs, and signposted as part of mandatory training and used for mandatory training, and ultimately bringing in that mandatory element to parts of it as a core competency in quality and patient safety for a given role within the organisation.
Yeah, absolutely. And I think I would share all those views as well, that in a year we'll start to see this, and some of the ideas and the language here will be normalized, I think, through this. And again, it's great to see, again, things like sustainability in here as well, which I think is something that we're really trying to promote, has been a core part of quality. And well, look, I want to just thank everybody, and again, I think it's a proud day, I think, for everybody involved here. This was a lot of work. I was involved at times, and I must say I'm very grateful for that involvement. But I think it is something that will continue to have a presence, the document, and I think it will, I think, inform a lot of practice, as we've just heard. There's lots of really nice comments coming in there, just really thanking everybody. I think some people from some of the co-design groups and the advisory groups, and fantastic work. Congratulations. Thank you for developing such a great competency framework. That's from Sinead Creedon in Cork. Looks like a well-designed and usable document from Emer. So lots of really nice, people can read them there. So I this is only the beginning of it. I think hopefully we'll see this become the bedrock of many, I think, training programs, of curricula, of HR processes, and I think we should really be promoting this internationally as an example of really good practice that has come out from the HSE in Ireland. So well done, everybody. I see Stephanie up there. I just want to give Stephanie a shout out, because I think there are always people in the background that make all these things happen. So well done, Stephanie, as well, for all your hard work. And it's fantastic.
Thanks, John.
Teamwork, I think, that's got us to this point. Yeah, well done. So I'm gonna just bring the slides back up. I'm going to thank our panel and everybody for speaking. Thank you very much. Orla, do you want to say a few words to conclude, or?
I think it's been said. Heartiest congratulations to everybody who's been involved. It is a wonderful piece of work. The proof of the pudding is always in the eating, but it is fantastic to have gotten to this point. It was a priority for us 3 years ago when the directorate was set up. We are now national QPS. Structures have changed again, but this competency framework will stand will stand the test of time. It is a live document that will grow and live. As long as quality and safety are a requirement in a health service, a competency framework is a requirement. So very well done to everybody who was involved, and thank you very much.
Thanks, Orla, and well done, everyone. So I'm just going to close out the session. Our next QPS Talk Time is on the 25th of February. So again, we would encourage people to join us. There's a QR code there to bring you to registration for that. This is about the important issue of our health service taking climate action. And we'll be joined by Dr. Philip Crowley and Roisin Breen, that I think will be a great session. And again, the importance of sustainability been reflected in the Competency Navigator as well. I think people should make themselves familiar with the competencies to improve sustainability within our health service. Just to make people aware, our Walk and Talk Improvement podcast is now available on Apple Podcast. So I think you can get it pretty much anywhere that you get your podcast, but you will also find it now on Apple Podcasts. There's a QR code that will take you to it. And there's a lot of really some great episodes there now, and we'd encourage people to check out. There's over 20 episodes, and you can check out those alongside all of the previous episodes of the QPS Talk Time. And that's a QR code there again to bring you to that on the YouTube channel, and you can download any episodes you missed. And if you want to tell people about today's episode, they might be interested in learning about the Navigator, you can direct them to that, and it'll be up in a few days' time. But really let people know about the QPS Navigator, and I think we should put it up on social media and share it on whatever networks you're in. Please let us know how we did today and how we can improve our future QPS Talk Times. There's a QR code there again to come onto our mailing list. You will get a short survey at the end of the webinar today. Please give your feedback, and I look forward to seeing you then in a couple of weeks' time at our next episode on the 25th of February. So good afternoon, and thanks a million.